Hey, good afternoon, everyone. Thanks for attending this webinar. It's a really valuable time that I appreciate it because I can share my insights, our team's insights and tools that we have developed and how we are using computational models in the medical field. So before starting the project, I will quickly explain a bit about my background. I kind of have a little bit of experience in the different fields of the healthcare system. For example, I've worked in a hospital and worked closely with patients and surgeons to actually understand the real needs, like of both of these like groups regarding the treatment, the surgical treatments. And then going back to my background, which is biomedical engineering, and now I'm doing a computer science, I'm doing a PhD in computer science. And together with some experiences I have from working in medical companies where they provide standard and also patient-specific implants, I look towards a solution, to find a solution and make a link between these fields to come to a solution to address patients and surgeons' needs actually. So first of all, as I'm going to talk about the hip joint, mainly the hip joint, I will quickly explain some anatomical terms of the hip joints and the diseases related to this area. And then I will explain the computational models that we have here and why do we need it, and bring up this question that is this generic, as Kenny already said. Can we extend this to all the people which are not unique, which are actually unique, each of them? And if not, which steps are we taking now to move towards a population study? So first of all, here you can see a bone model of the lower body. You can see the pelvic up here. If you can see my mouse, this is the pelvic bone. We have the femur, and they reach each other in the hip joint area. As you know, when you're walking, you have a lot of degrees of freedom, and the femur can easily rotate inside the pelvic bone. But it's really important that this movement be as smooth as possible and also stable. The stability and then this frictionless rotation comes mainly from the soft tissues that we have in the body, which is the cartilage, the muscles we have, the capsule, which like wraps around this joint completely. And you can see it here on the right, like this, for example, is a articulating cartilage. That this is what we are focusing more on rather than muscles and the capsule. So in an abnormal abnormal hip joint, this joint is not stable anymore. And in some severe cases, you can see that the pelvic cannot cover the femur completely anymore. And the femur just pops out from the joint. Well, of course, this can have different levels. Some people only have pain while they're walking, or in most severe cases, they can't walk at all. But the thing that we actually don't know is that what causes these hip dislocations, and is it related to age? Does it only happen in old generation? Is it related to a specific kind of disease? And if it is, what kind of disease is this? Or even, does it come from maybe a bad habit? Like, for example, I'm sitting all the time here behind my desk, and maybe I'm sitting in a way that can cause this in 5 years. But we don't know about these things. And in these kind of studies, we are trying to find these parameters, and as soon as possible, before it's too late. So help the diagnosis procedure. And okay, in the worst case, if it has happened, what can we do to improve the medical procedures? How can we improve? I've attended a surgery which was 4 hours, and they cut out a piece of bones, and like I was just standing there seeing what's happening. Like, I don't want this to happen. Can I come with an alternative that improve this method and make it like less invasive at least? Computational models, as Kenny mentioned, provide us with useful information regarding the biomechanical behavior of a hip joint. Like we can start from a normal hip joint, understand these moves, the loads that, like the pressure that the joint goes while we are walking, while we are sitting, and then shift to specific diseases and say, okay, in this such a disease, how these parameters have actually changed and what can we do to fix them, to bring them back to the normal case. So in this project, our focus is to develop the best computational model ever of the hip joint, and then use this model as a basis for population studies. And we want to answer questions, some of the ones that I already mentioned before. What are the critical forces? What age does this happen? Is it even related to age or not? And can we predict it earlier or not? And at the end, actually, what do we mean by the best? What is the best model? Does it really exist, and how should it be? So these are questions that we are looking for answers, actually. I will explain the model that we have developed so far. So we normally start by a patient going to the hospital, and then we have a CT scan, MRI, like different kinds of images. Here you can see a CT scan that I've used from Cancer Imaging Archive. And then the next step is to delineate the parts that you want. In our case, for simplicity, I'm just showing half of the pelvic to explain better on them. So we delineate the femur, which you see in green, and then the pelvic itself, which is yellow, and the other bones, and also the gap in between, which is the cartilage. This is a semi-automated procedure, and it's called like image segmentation. Then we have a 3D model out of this. And so here you can see, for example, 3 different cartilages in the joint and the bones as well. In the next step, we need to discretize this model into smaller elements called meshes. These are like triangles and tetrahedrals, which are volume triangles. We discretize them to solve the simulation and the scenarios that we want to simulate. Imagine I want to simulate a person just standing now and see how is the stress in the hip joint, how is the stress distribution or the pattern there. So one thing I need to know is about the loads being applied in such a scenario, and also the boundary conditions. Where am I going to fix if the person is standing? So for sure, it won't be able to move the leg at all. And these kind of things. And also the material, we need to define some material properties. How stiff should the bone be? How smooth and elastic should the soft tissues be? So we come up with some assumptions and apply them to the model. As you can see here, the load is applied here. We have fixed this for symmetry purposes. And as the guy is standing, we have it fixed right here. And then we run a simulation to see under these assumptions that we have made, how is the stress distribution, which I've brought just an example here. You can see the stress in the hip joint cartilage when a person is standing. And as you see, like the red parts show that the stress is higher here, and the blue parts is like, okay, it's a normal, not in critical one. And we should always be careful about these red parts. And especially in disease scenarios, this will go higher, and that can be a reason to just push the femur out of this area. So this is for these steps that I explained is for one patient. And as Kenny said, like this can take, like if you are lucky, maybe a month, or even like it's like it can take forever. But we are all unique. And in our case, this is not good at all, because then we have to do like this for every patient that comes in and put like 4 months for it, which is not feasible. So how can we come up with a solution that only do this once, have the pain just once, but later automatically adapt to the model that we have to any new patients which comes to the hospital? So we have came up with some solutions. This is the conventional method that I already explained, and the steps from the patient. We start the simulation framework, and then we have simulation results. But what if we have 6 patients? We've come up to this solution of using deformable image registrations. So you can see it here. we start with the patients. First of all, we combine these two information. So we have this as the reference. And using deformable registrations, we warp this model to fit into any new data that come through. We have for now just done it on bones. So any new data set that we have, we use our algorithm to warp the mesh and fit it to the new patient. And you can see like 3 examples here that we have. And then after that, we run the simulations and then have 6 more results like what we had. So this saved us a lot of time, and it's like it has made the procedure automatic. We somehow don't need to do this time-consuming segmentation anymore for the bones, and all of a sudden we have a lot of simulations. I'm showing here 3 to 6 patients, but what we are actually talking about is 1,000, 100 patients, 1,000 patients, and running such a simulation, just coming from this step to the results, where depending on the complexity of your model, can take up from minutes to hours. And if we want, like for 1,000 simulation, we still need to make this fast. And what we have done is that we are using clusters on the servers at the Department of Computer Science to run these simulations much faster. The other thing that we can actually improve is that, as I said, we are only doing this warping on the bones. What about the soft tissue here? Soft tissue is much more difficult because it's actually semi-automated in the it has a lot of manual steps you have to take. Like you segment it and then you need to clean it up. But this cleaning it up needs a lot of clinical background. You have to have a high clinical expertise to know where are these cartilages. And it depends on your image resolution and if your cartilage is really visible there or not. Can you even see it in the images, or you have to just predict something like in an ideal way. So we started another sub-project here where we automatically generated these cartilage to again save more time. And this time we only use the geometry of the bones coming in together in the joint area, in this case, like the pelvic bone and the femoral bone coming here, using the geometry of these two and the distance between these two bones and the curvature information on each bone, we came up with some patient-specific models of the cartilage stem cells. We have tried this on several bone models to see if it works. And besides the hip joints, we are also trying it on other joints like the shoulder joint or the knee joint to see if this method is generic at all or not. And it's a fast solution. The other one might take like up to weeks, but this is like a maximum 1 hour. The whole thing would be wrapped up. And it also has this non-uniform thickness, which makes it more realistic. So these are the 2 main approaches we have had so far. And based on what we claim is that now we can, for example, run a lot of simulations. But what is it good for actually? When we have these simulations, what are we going to do with all the data that we get? I said we measure the stress distribution. Another parameter is that you can measure the displacement, for example. What are we going to find from these? So if we put all our data in front of us and try to analyze them, we can group them into, for example, the data we have regarding the geometry, like how old was this guy that we had, how old was this guy that we had the data from? Which gender is it? Is it a diseased case? Is it a hip joint related disease? And other landmarks that normally, if you have a radiology of your knee, you will have some landmarks that the surgeon normally measures. You can use those biomarkers. And also from the simulation framework, as I explained, we have a body weight, we have different loads, we have boundary conditions, we have the contact, the sliding thing that I explained, and the material properties. And in the results, we can have stress distribution, displacements, rotation of the femur while you are walking or sitting, lying down. So we have all of these data. We have categorized them into these. But by combining these, we can also generate newer models, new models, and then run simulations and come up with these feature vectors and get some simulation results, as you can see here, and do a kind of analysis to find the most critical parameters. To actually, is the age parameter really important? Do I see like the stress pattern, does it change when the age has changed? Or if the guy it has a disease, for example in the knee, does it really change the effect of the simulations? Is it really important to have an accurate bone model? Maybe I can just put a severe into like a cup shaped and say this is enough for modeling a hip joint. So to know the level of accuracy, and in general to know the most critical parameters that we need for modeling the best model ever. So this is what we are working now on. We are generating more models and analyzing the data to get to a generic model, which can hopefully present a hip joint, the main parameters, the main critical parameters of the hip joints, and the ones we need to always take in mind when we want to automate steps. Thanks for your attention. Yeah,